Did you know that pancreatic cancer takes the lives of more seniors every year than colon cancer? Even so, most people over 60 have never been told about its early warning signs. And that is what makes it even more dangerous. The symptoms often appear months before the cancer becomes untreatable. Months. They are happening inside people right now while they sit in their living rooms thinking they just need more sleep, or that their back is hurting again, or that their stomach feels off lately. Right now, as you read this, there is a 75% chance you have already noticed at least one of these 8 symptoms and simply brushed it off as something else. I'm Drive, Jason, and what I'm about to explain in the next few minutes is something most seniors will never hear from their own doctor. Because here is the truth nobody tells you. Pancreatic cancer does not have an 11% survival rate because it cannot be treated. It has an 11% survival rate because it is usually found too late. Stay with me through all 8 symptoms, especially symptom 5. That one has never appeared on most lists doctors give to senior patients, but it should have been first. Before we go into the symptoms, you need to understand one important thing about why this disease is so dangerous for seniors. Your pancreas cannot be felt from the outside. A doctor cannot check it during a routine exam. And standard blood work will not detect this cancer until it has already spread. That is not a weakness in the system. That is exactly why this disease is so deadly. It hides behind symptoms people have been blaming on aging for years. Here are the 8 warning signs it can leave behind while it is still treatable. Pay close attention to every single one. 1. Dark urine that keeps returning. Most seniors who notice dark urine try one thing first. They drink more water. The urine may lighten for a day, and they assume the issue is fixed. That assumption has cost people their lives. Here is what is really happening. Your pancreas sits close to a tube called the bile duct. This duct carries a substance called bilirubin from the liver into the intestines. Bilirubin helps give urine its normal light yellow color and stool its normal brown color. When a tumor grows in the head of the pancreas, it can press on that bile duct. It can squeeze it shut. It can block it. When that happens, bilirubin cannot flow properly, so it backs up into the bloodstream. Your kidneys then try to remove it through the urine. That is why urine becomes dark yellow, brown, or the color of strong tea or cola. And here is the key difference between this and simple dehydration. It keeps coming back. You drink water, it improves for a while, then the next day it is dark again because the blockage is still there. If your urine has been going back and forth between dark and normal for more than 2 weeks, no matter how much water you drink, that is not a hydration issue. That is something you need to discuss with your doctor this week. 2. Pain your doctor may already have named incorrectly. The next symptom is even more dangerous because your doctor may already have seen it and given it the wrong label. It may have been called arthritis, a pulled muscle, an old injury, acid reflux, or even a combination of all 4. While you were treating the wrong condition, the cancer was gaining time. Pancreatic cancer pain has a very distinct pattern. It often begins as a dull, constant ache in the upper abdomen, not the lower belly and not the sides. It starts just below the breastbone or slightly to the left. Then it spreads. It wraps around the middle and reaches into the back, almost like a band tightening across the torso. This happens because the pancreas is surrounded by a dense network of nerves. When a tumor grows, it presses on those nerves and sends pain in several directions. 3 things help distinguish it from ordinary back pain. First, it gets worse after eating, usually within 30 to 60 minutes. Second, it worsens when lying flat on your back, which is why some people end up sleeping in a recliner or on extra pillows. Third, it does not improve the way normal pain does. Ibuprofen, heat, and rest may help a little, but the pain returns in the same pattern because the source has not been addressed. If this sounds familiar, stop calling it back pain. Tell your doctor the pain starts in the upper abdomen, radiates to the back, gets worse after meals, and is worse when lying down. 3. Feeling full after only a few bites. The third symptom is more serious than both of the first 2 because it is not just being ignored. It is quietly starving your body. You sit down to eat, take a few bites, and suddenly you are done. You push the plate away and tell yourself your appetite just is not what it used to be. But this is not just a change in appetite. It may be a tumor pressing on your stomach from the outside. As the tumor grows, it can push against nearby organs. Since the stomach sits in front of the pancreas, pressure from behind can reduce the stomach's capacity. It fills up much faster than normal. At the same time, the tumor can interfere with the pancreas's ability to produce digestive enzymes. Without those enzymes, food stays in the stomach longer and the body does not absorb nutrients properly. That creates early fullness, poor appetite, and unexplained weight loss. If you have lost 10 or 15 pounds without trying, that is not a positive sign. It is a warning sign. Unintentional weight loss of more than 5% of body weight over 2 to 3 months is medically serious. When 3 bites and done happens, it is never just an appetite issue. 4. Jaundice. Jaundice happens when bilirubin builds up in the blood and begins to show in the tissues. The skin may turn yellow, and the whites of the eyes often become yellow as well. In people with darker skin tones, it is often easier to spot in the eyes and palms. There is another sign many people do not connect with it: intense itching all over the body without a rash. Lotion and antihistamines usually do not help. That happens because bilirubin irritates nerve endings in the skin. A dangerous part of jaundice in seniors is that it can look exactly like jaundice caused by gallstones. The yellowing, the dark urine, the itching, it all looks the same. Since gallstones are common in people over 60, this is where mistakes can happen. A doctor may suspect gallstones first and delay deeper testing. That is why you should not describe it as just, "I look yellow." You need to give the full picture. Dark urine, upper abdominal pain that goes to the back, early fullness, and yellowing of the skin or eyes. Those signs together tell a much more serious story. 5. An unexplained blood clot. This is the symptom that has sent seniors to the emergency room before anyone realized what was happening. It is often overlooked, but it can be life-threatening. Think about whether you or someone you know has had a blood clot without any clear reason. No surgery, no long flight, no obvious explanation. Pancreatic cancer can release proteins into the bloodstream that make blood clot too easily. The most common place this happens is in the deep veins of the legs. The calf or thigh may swell. It may feel warm. It may ache with a deep, heavy pressure that does not go away with rest or by elevating the leg. The real danger is that part of the clot can break off and travel to the lungs. If that happens, sudden shortness of breath, sharp chest pain that worsens when breathing in, and a fast heart rate can occur. If those symptoms happen together, call 911 immediately. Studies have shown that in many pancreatic cancer patients, an unexplained blood clot was the first sign that something was wrong, sometimes 6 months before the cancer was discovered. 6. Recurring unexplained fever. This symptom often gets blamed on a virus, but a virus usually clears. This keeps returning. People may have a fever one day, feel better, then get another one a few days later. That pattern does not fit a simple infection. Pancreatic cancer can cause ongoing inflammation in the body. The pancreas becomes inflamed, bile may back up, and the immune system keeps reacting to the problem. The result can be repeated low-grade fevers, chills, and night sweats. You may wake up damp from sweating even when you were not hot when you went to bed. The fever may not be high, maybe only 99 or 100 degrees, but the pattern is what matters. If a fever keeps coming back for weeks and no infection is found, that needs imaging, not just another prescription. 7. Fatigue that rest does not fix. This is the symptom that quietly affects everything else. You may think you are just tired, but this is different. You slept 8 or 9 hours and still woke up exhausted. You rest all afternoon and still feel drained. Tasks that used to be easy, walking to the mailbox, carrying groceries, climbing one flight of stairs, suddenly feel overwhelming. Cancer-related fatigue is not the same as ordinary tiredness. It does not improve with rest because the body is being robbed of fuel. Pancreatic cancer cells compete with healthy cells for glucose and nutrients. Your body runs on less than it needs every day, and no amount of sleep can replace what is being taken. If the fatigue feels heavier, deeper, and more constant than normal tiredness, it should not be ignored. 8. Stool changes. This is the symptom people rarely talk about, but it may be one of the most important warning signs. The pancreas makes enzymes that help break down fat in food. When a tumor blocks the pancreatic duct, those enzymes cannot reach the intestine. The fat passes through undigested, and that changes the stool in specific ways. It may become pale, gray, or clay-colored instead of brown. It may look greasy or shiny. It may float in the toilet. It may also smell much worse than usual. These are not random digestive changes and not just something you ate. They are signs that the pancreas is not working properly. You may also notice nausea after eating fatty foods, vomiting, bloating, or a heavy feeling after meals. Because fat is not being absorbed properly, vitamins are not absorbed well either, which worsens weight loss and fatigue. If pale, greasy, floating, foul-smelling stool continues for more than 2 weeks, call your doctor within 24 hours. Before you close this video, I need 1 more minute of your attention because what you do in the next 24 hours may be the difference between early detection and late detection. Pancreatic cancer is not automatically a death sentence when it is found early. Stage 1 outcomes are completely different from Stage 4 outcomes. The biggest difference is what a person does after the first warning signs appear. Most people wait. Most people assume it is aging. Most people never get the chance to explain what they ignored. So here is what to do now. Write down every symptom you recognize from this video, including when it started and how often it happens. Then call your doctor and read the list exactly as written. Do not summarize it. Do not just say you feel off. Be specific. Specific symptoms lead to specific testing. If your doctor dismisses your concerns, ask whether a CT scan or ultrasound of the abdomen is appropriate. You are not being difficult. You are being careful. Do not leave this video and go back to calling it aging. You now know too much to do that.